Hello and welcome to session 1 of our Suicide Bereavement e-learning module. Today I'll be reviewing with you statistics, rates, and risk factors of suicide. The majority of the statistics I'll be reviewing with you today come from the Australian Bureau of Statistics and the Australian Institute of Health and Welfare. They've been collected quite recently, and just take note that all the statistics I will be giving you today are based on the Australian population and are not necessarily representative of worldwide or other countries' figures. In Australia, every year, 1 in 20 children will experience the death of a parent prior to the age of 18, which amounts to about 300,000 children. Suicide will affect a large portion of those children as well. So suicide, from the Latin suicidum, is the act of taking one's own life. Essentially, suicide is death caused by injuring oneself with the intent to die. Suicide happens when a person's intense emotional and mental pain becomes far greater than their ability to cope with it. A suicide attempt, or non-fatal suicidal behavior, is self-injury with any intent to end one's life that does not result in a death. Suicidal ideation meaning thinking, involves the thoughts of ending one's life, but not necessarily taking any action or efforts to do so. It may or may not involve exact planning or intent to act. So the next few statistics are going to be based on 2020 data, which was released by the Australian Bureau of Statistics on the 29th of September, 2021. 3,139 Australians died by suicide in 2020, which represents an age-standardized suicide death rate of 12.1 per 100,000 people. This is an important one. 9 Australians die every day by suicide. That's more than double the road toll. So one is more likely to die by suicide than die in a motor vehicle accident in Australia. Suicide was the 15th most common cause of death overall, and that's down from 13th in 2019. It accounts for 1.9% of deaths. Suicide is the leading cause of death for individuals aged 15 to 49 in Australia. The median age of death by suicide is 43.5 years, and that's compared to 81.7 years for all causes of death in general in Australia. In 2020, 454 young people aged 15 to 24 died by suicide. And that year, over 1/3 of those deaths within that age bracket, 15 to 24, are due to suicide. 1 in 2 young people are impacted by suicide by the time that they turn 25. For each life lost to suicide, the impacts are felt by up to 135 people, which may include family members, work colleagues, friends, and the first responders at the time of the death. Males are around 3 times more likely to die by suicide than females, and males accounted for 75.9% of deaths by suicide, which represented an age-standardized suicide death rate of 18.6 per 100,000 people, compared with the rate of 5.8 per 100,000 people of females. People in rural populations are 2 times more likely to die by suicide, and the suicide rate in Aboriginal and Torres Strait Islander people is twice that of their non-Indigenous counterparts. Homosexual Australians are estimated to experience up to 14 times higher rates of attempted suicide than their homosexual peers, and those within the LGBTIA+ community members experience significantly higher rates of suicide than the rest of the population. Depression, anxiety, and substance use problems, especially when unaddressed, increase the risk of suicide. Biology and genetics may play a large part in mental health challenges and risk of suicide. There are 3 categories of risk factors: health, environmental, and historical. When present at the same time, there's an increased risk of suicide. The 3 most frequently occurring psychosocial risk factors for men, as they were the most common to be affected by death by suicide, were personal history of self-harm, disruption of family by separation or divorce, and problems in relationship with a spouse or partner. The three most frequently occurring psychosocial risk factors for women were, again, a personal history of self-harm, problems in a relationship with a spouse or a partner, and the disappearance or death of a family member. So we want to keep some of these things in mind. If you know someone who seems to be at risk of suicide and they've been experiencing some of these risk factors, then we want to make sure that maybe they are addressed, that they're spoken to, and even offered some support. I will talk about the impact of suicide bereavement in the next learning module. Thank you very much for listening, and I'll see you soon.